Students with life-threatening allergies, Epipen training. Students can have life-threatening allergies due to a variety of causes. Some include peanuts, tree nuts, soy, dairy, eggs, fish, shellfish, wheat, bee stings, or latex. Symptoms that a person is having an allergic reaction can include difficulty breathing, slurred speech due to swelling of the tongue and throat, massive hives over a large portion of the body, anxiety, stomach ache, red blotchy skin, puffy eyes, wheezing, rapid pulse, shock, or unconsciousness. Our school policy prohibits peanuts and peanut products in common classroom areas where a student with a peanut allergy might be. Specific classrooms will be peanut-free. There's a peanut-free table in each cafeteria monitored by the paraeducators. Teachers with students with any life-threatening food allergy should review the school policy with the school nurse. Treatment of exposure or ingestion to an allergen is the Epipen. The Epipen is a disposable drug delivery system with a spring-activated, concealed needle. It provides rapid first aid for individuals experiencing allergic reactions. The medication given through the Epipen is adrenaline or epinephrine, a hormone made naturally by your body. Because it is a natural part of your body, it is better to give the student the injection if you suspect they are having a reaction. Even if it turns out that they did not need the medication, there will be no harmful effects from giving it. The Epipen causes smooth muscles to relax in the lungs and constricts blood vessels to improve breathing, stimulate the heartbeat, and reverse hives and swelling around the face. The medication has a rapid onset but also wears off quickly. Anytime you use the Epipen, you must call 911, as the person may need more of the medication to stop the reaction. Even if the person seems fine after receiving the Epipen, it is important to call 911 and have the person transported to the hospital. When administering the Epipen, follow these steps. Pull off the gray cap. Remember that this is what activates the spring-loaded device and is not the end with the medication. Think of the device as a pen. The needle comes out through the black-tipped end of the pen. At this point, it is important to stay calm and do not drop the Epipen. Dropping the device would activate the spring, exposing the needle and discharging the medication. The medication will be given in the outer thigh. You can inject the medication through the clothing, avoiding the seam in pants, which is too thick for the needle to go through. If the student is wearing snow pants, they would need to be removed, as the clothing would then be too thick for the needle to penetrate. Hold on to the student's inner thigh to stabilize the leg. It would be helpful to have another adult holding the student as well. When the needle comes out of the Epipen, it makes a loud click, which may make the student jump. Do not react to the noise yourself and pull back on the device too soon. Grasp the Epipen firmly in your fisted hand. Press the Epipen hard against the outer thigh. You will then hear the click. Hold the Epipen in place against the thigh for 10 seconds. Remove the Epipen and massage the injection site for 10 seconds. Call 911. Remember that the person may require a second injection, so they need to be transported to the hospital as the medication wears off quickly. Notify the parents and the school if you are on a field trip. After using the Epipen, put it somewhere safe, as the needle does not retract back into the device. You can place it back in the carrying container it came in, or any hard container you have. Give the used Epipen to the EMTs when they arrive for safe disposal. If you forget how to use the Epipen, remember that the instructions are printed right on the Epipen. If you are at school and are the first person to find a student or staff member having a severe allergic reaction, do not wait for the school nurse if she is not in the health office. All of the emergency medications are kept in an unlocked cupboard in the medication room of the health office. Take the medication to the student and give it, then call 911 if someone is not doing that for you already. Then notify the school nurse. Visit the health office if you are not sure where the emergency medications are stored. Any school employee that may be involved with a student on the health concerns list who has a life-threatening allergy needs to see the school nurse in their building to do a return demonstration on the use of the Epipen.